This video is about COVID-19 myths. 1. COVID-19 can be transmitted through mosquitoes. The mosquitoes are an agent of transmission for a lot of diseases and infections, which lead many to wonders. Can mosquitoes also cause the transmission of SARS-CoV-2 virus, which has caused the COVID-19 infection all over the world? According to the World Health Organization (WHO), the mosquitoes cannot cause the spread of COVID-19 from one person to another. And it is also something that various experts have agreed upon. To further research the possible association between mosquitoes and COVID-19 causative agent SARS-CoV-2, an experimental study was conducted to find how the extent to which this virus can infect or be transmitted through a mosquito. The types of mosquitoes that most commonly infect humans are known as Aedes aegypti, albopictus, and Culex quinquefasciatus, were included in the study. And it was investigated whether the virus will be able to replicate inside the bodies of these mosquitoes. The results showed that these mosquitoes could not transmit the virus due to its inability to replicate inside them, even in the extremes of conditions. Myth 2. COVID-19 is just like the common flu. Due to some of the similarities of initial symptoms with the common flu, people started underestimating the possible dangers of COVID-19 and thought of it as just like the common flu. Even with the rising death tolls all over the world, there is a good number that believes it is all a myth, and it is nothing more than the flu, which will get better on its own. People have also started pages and movements on different social media platforms where they are spreading misinformation about the new COVID-19 virus, which is known as SARS-CoV-2, and making those who read it believe that they probably should not take the whole pandemic seriously. However, the numbers and stats all over the world tell a completely different story. More than 1.5 million people all over the world have lost their lives due to the coronavirus, and out of which almost 350,000 lives have been lost only from the United States. However, if we compare this death toll to that of other flu-like diseases, the numbers are much lower, proving the severity of COVID-19 and just how different it is from the other diseases. Moreover, unlike the common cold and flu-like diseases, which tend to get better within weeks, the symptoms and after effects of COVID-19 may last for months, with some very unique symptoms, like swollen toes and brain fog. Myth 3. Transmission of COVID-19 only in colder climates. Since the first case of COVID-19 mainly came in the winter season, it is a common belief that the infection only spreads in the cold, and that in summers, the heat may be able to kill the virus and prevent its spread altogether. Even though previous studies have hinted at a possible effect of weather on the spread of the virus, it is a minor one, and meteorology cannot be the sole factor in deciding how fast and how many people the SARS-CoV-2 virus may be able to affect. To further study the effect of different temperature and seasons on the spread of COVID-19 and the viability of the virus, research was conducted with the aim of evaluating the role of weather in COVID-19 spread, while keeping in mind factors like mobility, urban density, information about the demographics, and the use of masks amongst the communities. The researchers also made sure to include factors like the temporal and facial scale when finding an association between the weather and the rate of transmission of COVID-19 for more promising results. The finding of the study showed that the mobility index was the highest factor responsible for COVID-19 spread. which was followed by homestay, which was at nearly 26%. The population, which was at 23.86%. And then urban density, which was at a percentage of 13%. While all these factors were seen to influence the COVID-19 spread, weather with a percentage of less than 3% was claimed as an influential factor. Hence, it is incorrect to assume that the COVID-19 virus may only spread in the winters, as the weather has a very little role in its spread. Myth 4. Prevention of COVID-19 by eating garlic. Garlic is known for its numerous health benefits on the body, whether it is for the respiratory tract, for the stomach and digestive issues, headache, or even immunity. However, it does not mean that this food source may be able to single-handedly prevent the COVID-19 infection. Ever since the start of the COVID-19, people have been looking for possible cures and preventative sources for the disease. And in their fear and uncertainty, many started spreading false information about garlic acting as a possible vaccine against the virus. Garlic is known for its anti-inflammatory and antioxidant effects on the body, in turn helping protect the body from chronic diseases by eliminating the harmful substances and boosting the immune cells. It may help boost immunity and might even help with the symptoms of the infection. But according to the World Health Organization, WHO, there is no proof of it protecting its consumers from the new coronavirus. Myth 5. COVID-19 is being used as an excuse for worldwide vaccination. Vaccinations are also looked upon with caution, no matter what disease it is made for. Those who don't believe in the power of vaccinations are always looking for excuses of how it may not actually be doing what it says it is supposed to do, and how it may in turn be leading to greater damages in the body. Even since the news of the new COVID-19 vaccine being approved by the governments of numerous countries came out, people have been skeptical about its efficacy, and there have been a number of rumors about what it might possibly do to the body. Some even claimed that COVID-19 does not exist, and this is all a scheme to earn money, introduced by the pharmaceutical companies. Moreover, there have been rumors about the use of vaccines as a way to inject microchips in our bodies to easily help control, manipulate, and track our thoughts and movements. However, there is not much truth to any of it. And the truth still remains that thousands of people are dying all across the globe due to this deadly virus. And there is a need now, more than ever, for a vaccine to help protect millions of lives, just like it was done earlier for other diseases. Myth 6. Prevention of COVID-19 using other vaccines. Getting a vaccination as a prophylactic measure against a new virus or infection is one of the best ways to get protection against the disease. These vaccinations can be done using different kinds of pathogens, which will in turn create antibodies in the body against the virus. Two of the most popular vaccines used for this purpose include inactivated virus, which may include killed viral substance, while the other is the virus in its active form, but with its virulence significantly reduced. This is done to make sure that the vaccine does not cause any harm to the body due to the introduction of the viral particles through it, but at the same time stimulates the immune system against the infection to provide immunity against it, while the dead viral particles may only induce an immune response that is enough to work against the specific virus. The live but attenuated form of the virus, when introduced in the body, may activate the immune system enough to not only produce immunity against the specified virus, but for other infections as well. The reason that has been suggested for this is its ability to cause interferon, and innate immune system activation. However, the subject still needs more research. Ever since the first 100 cases of the SARS-CoV-2 in the world, people had been looking for possible preventative measures against the virus. And this has led to speculations about other vaccines to be effective against the new virus. However, this is false. And the popular vaccines against influenza, pneumococcal infections, and pneumonia are not effective against the coronavirus. And their use will not guarantee your protection against it. This is because this virus is very different from the others. And it requires a vaccine of its own to be able to protect your body against it. This was further investigated in a study conducted by Mihai Neta, who is an infectious disease immunologist in the Netherlands, and is working at the REDBUDS University Medical Center. With the help of his colleague, the investigator collected data from the hospital databases to further evaluate the number of people who had gotten the flu shot in the time period of 2019 to 2020, and how it affected the potential of them getting infected with the SARS-CoV-2 virus. The results showed that those who received the flu vaccine had 39% fewer chances of getting infected with the COVID-19 virus, proving that unvaccinated individuals were more likely to test positive for the virus than the vaccinated ones. However, this difference was very slight, and getting a flu vaccine does not guarantee anyone protection against COVID-19. They also suggested that the flu vaccine may not be slightly related to the partial protection against the SARS-CoV-2, as it could just be a coincidence. Or those who were conscious to get the flu vaccine might also be conscious about their health, and in turn, had fewer chances to get infected. To further evaluate if a true relationship exists between the flu shots and COVID-19 infection, studies of a much larger scale are required to come to a definite conclusion. Myth 7. Mask does not protect against COVID-19 virus. There are a large number of people who believe that the introduction of masks as a safety precaution is just to take the freedom away from the people, and that the government has no right to impose such a rule on the citizens of its country. Furthermore, there are also many that believe that these masks are absolutely no help against the latest coronavirus. And if anything, it may only prove hazardous to health, like promoting cancers of different types. However, this is absolutely false. Numerous studies have proved that the most common route of spread for the COVID-19 infection is through the droplets that are emitted from one's mouth after they sneeze, cough, talk, or even sing, and if the other person, who is within 6 feet or 2 meters, inhales these droplets, there are high chances for them to get infected. Even though maintaining a distance of 6 feet is one way to protect oneself from the virus, it is not very practical, and may even prove to be impossible in outdoor settings. Hence it is essential that one wears a mask to not only protect themselves from the aerosols in the air and the droplets emissions from those around them, but also protect the people around them in case they are asymptomatic carriers of the virus. Myth 8. COVID-19 has no long-term complications. People commonly compare the new COVID-19 virus to the common cold and flu-like disease that many of us have experienced at some point in our life. While these diseases and their symptoms may mostly subside within days, the symptoms and complications of COVID-19 may last much longer than that. It has been reported that those individuals who recovered from the COVID-19 infection with non to mild symptoms may continue to experience complications associated with the disease. even months, after they are tested negative for it. Although these individuals commonly include those who belong to older age groups, and also those who have already been suffering from chronic diseases, it is not only limited to them. Some people who claim to be healthy before their COVID-19 infection continue to experience severe weakness, body aches, and even hair falls months after their initial diagnosis. These unique symptoms, and their variable durations, are what differentiates COVID-19 from all the other flu-like infections we have experienced previously, which is why it should not be taken lightly. Here ends this video on COVID-19 myths. Don't forget to check out the other COVID-19 videos on this channel. If you found it valuable, like, comment, share, and subscribe to receive alerts when we produce these types of videos in the future. Subscription to our YouTube channel is totally free. Thanks for watching. Note: this information is for education and reference only. It is not meant to replace the informed advice of your doctor. If you believe that you have a health problem, please consult your doctor or health care provider. Do not resort to self-help. We hope you enjoyed this video. See you again soon.